The human eye is a sensory organ in the visual system that reacts to visible light, allowing eyesight. At Retina Specialists of Colorado, you can expect a warm and welcoming environment where Dr. Ross Chad, Dr. Michael Jansen, and Dr. Zachary Koretz and their staff can answer any questions you may have about your condition, symptoms, or the overall health of your eyes.
Having problems with your eye and your vision can be quite scary, and nobody should have to go through that alone. At Retina Specialists of Colorado, we provide world-class retina and ophthalmic care to all Coloradans. We have 7 convenient locations to serve our patients in Denver, Aurora, Littleton, Arvada, Centennial, Edwards, and Basalt. At Retina Specialists of Colorado, we provide state-of-the-art retina care for a vast array of retinal conditions, including age-related macular degeneration, diabetic retinopathy, retinal tears and detachments, macular pucker and macular holes, retinal vascular disease, floaters, and many more.
Age-related macular degeneration is the leading cause of permanent vision loss in patients over 65. Studies show that about 20 million people across the United States are affected by the condition, with about 12% having an advanced form of the disease. The 2 advanced forms of the disease are what is known as wet macular degeneration as well as geographic atrophy. Using injectable medications, we can actually reverse the vision loss associated with wet macular degeneration. And now, for the first time ever, we can slow the progression of geographic atrophy, thereby saving vision. Diabetes is a disease that affects the level of sugar in your blood. If blood sugar levels are consistently too high over time, it can cause extensive damage in the small blood vessels throughout your body, including the ones found in your retina, which is in the back of your eye. We can use injectable medications to stop the growth of new blood vessels and to prevent swelling, bleeding, leakage, and scar tissue formation, thereby preventing and reversing vision loss. In more advanced cases, we use laser treatments and sometimes eye surgery to halt or reverse vision loss from diabetic retinopathy.
Clinical research plays a major role in developing new treatments and improving outcomes for patients with retinal diseases. We are proud to be actively involved in clinical research for many retinal diseases, helping to shape the future of eye care and providing our patient with access to the latest advancements in retinal care. Our clinical trials are not only available to patients with newly diagnosed conditions like wet macular degeneration, geographic atrophy, and diabetic macular edema, but some are also available to patients who have already been receiving these treatments for these conditions. It's really wonderful to be able to offer these treatment-experienced patients a new path forward in their retinal care. We're currently enrolling in clinical trials for the following conditions: wet age-related macular degeneration, geographic atrophy, and diabetic macular edema.
The path towards better vision and eye health starts with plenty of face-to-face time with your doctor. This philosophy is the foundation of Retina Specialists of Colorado. They proudly provide world-class retina and ophthalmic care to all Coloradans.